So, as we all know, LAM stents have been on the market for roughly 10 years or so. They're used for a variety of on-label indications such as drainage of parapancreatic fluid collections, gallbladder drainage in non-surgical candidates, in bile duct drainage in cases of failed ERCP and/or malignant distal obstruction, and also in off-label indications such as creation of luminal anastomosis, drainage of post-surgical fluid collections, and management of short refractory gastrointestinal strictures. However, even though they've been on the market for 10 years, only recently there have been some attempts for guidelines, and they've been recently published by the ESGE in 2022 and the AGA in 2023. The lack of these guidelines resulted in, of course, unstandardized technique with significant adverse events. So, as it's with all cases in life, I guess it's best to avoid stupid things than to get into a stupid situation and then try to get out of it. Based on that, Dr. Hendricks and I generated 60 statements after a thorough PubMed search on the LAMS literature and also our own experience. And we generated 60 statements regarding general recommendations on LAMS use, such as optimal learning pathway, pre-procedural imaging, airway protection, safety measures during procedure, use of Doppler imaging and distance measurement, and specific recommendations regarding the indications, selection of suitable patients, need for antibiotics, LAMS dimensions, optimal locations, coaxial pigtail positioning, and management of adverse events. So, to continue on, in general recommendations, we accepted 12 statements. As was already said today by Dr. Iglesias, training is extremely important. It is essential to undergo basic training before clinical application of any medical procedure, be that LAMS or not LAMS. So training should encompass theoretical knowledge and hands-on practice on animal models. This helps by decreasing the rate of adverse events. Sufficient experience in deployment should be achieved in placing LAMS in large volume targets such as peripancreatic fluid collections of more than 3 centimeters before continuing to more advanced procedures such as gastroenterostomy and common bile duct drainage in less than 15 millimeters. Before proceeding, of course, once you achieve expertise in peripancreatic fluid collection, you should undergo another advanced training program under expert supervision.
So, because I only have 2 hands, one hand is on my elevator up and down wheel, and my right hand needs to go on the axis, I will ask, what's your name?
Iwot.
Oh, I can't pronounce your name, sorry. Iwot?
Iwot, perfect.
Iwot, I'll ask Iwot to hold my scope with a slightly counterclockwise torque. Mm-hmm. So we have to be very coordinated. And at the count of 3, I'm pressing, but not stepping on the pedal. So then I need another assistant, not Iwot, to bring the pedal to my foot. I cannot move or I will lose my carefully selected entry point. Mm-hmm. So you see, even inadvertently, we lose deep depth of target. So I have now the pedal at my right foot. I'm going to go in at the count of 3.
Will you check with Doppler before you go in?
Why would, somebody do that? Yeah, that's interesting that there are no vessels that we can see, so Doppler shouldn't pick up, but that's a good tip, thank you. So at the count of 3, I try to go perpendicular to the muscle layer, the gallbladder wall, and have a landing space. I adjust this with a large wheel. 1, 2, 3. Okay, and there's always a blind moment. We lost the trajectory, and there is a question: are we in or are we not in? So there are 2 ways to check that. I'm thinking I'm not through, mm-hmm. So I need, because I cannot see the tip counterclockwise like this and pushing a little bit inwards, mm-hmm. And I'll go back in. Okay, I felt it and I saw it. If the target were a little bit larger, I would probably use, would you hold here, please? So I'm going to use fluoro now.
Do you consider to put the guide wire in?
Yes, this is one of the situations in which a wire would be helpful
Shall we
because gallbladder is mobile.
0.025?
0.25.
Yeah.